Joining us at 5:30 is Ballad Health Chief Infection Prevention Officer Jamie Swift. We want to say on the front end of this, we've got a bit of a connection issue, so we're going to do our best with this. Jamie, thank you so much. First off, your reaction to the numbers here. It does look like we are continuing to see the downward slide. That's good news.
It is. We are certainly on the backside of this Omicron surge, so we're happy to see those numbers coming down. We do think they'll continue to come down over the next couple of weeks.
Golly, that's great news. A couple of weeks ago, hospitalizations were like at 454. It was your record high. We're down 130 since then, but we've also seen death numbers increase. In Southwest Virginia, we saw, that increase last week to 45 from 28 the week before. And we know the numbers of deaths that are being reported related to COVID lag. So what are you seeing in terms of deaths right now? And are you concerned that that's going to be the most troubling part of what's to come?
It is. I think there was a lot of confusion around Omicron is mild, and what we see is Omicron was milder in those who were vaccinated and boosted. We've certainly seen an increase in deaths during the surge, as one would expect when you have that many people in the hospital. We're still seeing deaths. We reported several deaths last week. I'm hoping those numbers will slow down. But that's really an important point for people to remember, is that COVID is still taking lives, and it's taking lives early.
Another thing we've seen with Omicron is that it does seem that more people who have gotten the vaccine do in fact end up in the hospital. Not as many, but more. For instance, last Wednesday, Ballad showed 15% of your hospitalizations, 11% of your ICU patients had been vaccinated. What is your message to people tonight who are hearing that and seeing that and are saying, well, maybe this vaccine, I shouldn't get it after all, a year into having it being available?
Yeah, so the main message is the vaccines do work. They do keep most people out of the hospital, certainly keep people out of the ICU. What we're seeing is right now is a real need for boosters. We've seen that with Omicron. That booster dose is extremely important. And so that may not always be reflected in their data. Are they fully vaccinated, which is 2 doses, or up to date, which is the 3 doses. You also are always going to have increased hospitalizations with people who have weakened immune systems, who maybe did not have the response to the vaccine, or those who are not able to be vaccinated.
So I want to make sure I'm clear. You're saying that that portion of the population that's hospitalized, that's been vaccinated, many of them you're saying haven't been boosted or have immunocompromisation. That's probably not a word, but they're immunocompromised. Is that what you're saying, that's kind of representative of that population that's vaccinated and yet hospitalized?
Yeah, it really is the majority of that population. We certainly are going to have some who are vaccinated and boosted come into the hospital, but really the booster is doing a great job of keeping people out of the hospital.
We are hopefully past Omicron as we move forward in the weeks to come, but I know you're also worried and have been watching this Omicron BA.2 variant. What's the latest that you're hearing as you're in that world of trying to prevent infection in health systems? What are you hearing about that latest variant?
Yeah, that's really where we're shifting our focus, is what we talked about in our command center this morning and SEOC. So there's a lot of unknowns. BA.2 has the potential to cause another surge. Will it? We don't know yet. We do know it's more infectious. We do know that it may not respond to the monoclonal antibody treatment. And we just don't know severity of disease. So all of those things are things that we're watching. We're reading as much as we can read. Still more questions than answers, but certainly we're using this time to prepare our staff, our health system, and use the time to encourage our community get vaccinated and get boosted.
And that still is the message. It's not too late to get that vaccine for the first time.
Right. I know some people at this point say, well, gosh, I hate to come in and ask for my first dose. And we're truly thrilled. If you've made it this far and you decide now, hey, I've seen enough evidence, I want to get that first dose, come in. That kind of rejuvenates our soul to know that we've got one more person vaccinated. It's never too late. We don't know what the pandemic's going to bring in the coming weeks or months. So if you've not been vaccinated, if you've not been boosted, that really is the most important thing to do right now.
Jamie Swift at Ballad Health, thank you as always.
Thank you.
Stay